Earlier this week, the Alaska Department of Health released a public alert regarding a spike in whooping cough, also known as pertussis. That spike was seen in July, which recorded more than 3 times the number of cases seen in June. And this spike isn't just in Alaska. It's happening nationwide. Reporter Adrian Peterson spoke with our state's epidemiologist to learn more about the spike, the illness, and the impacts seen in the Fairbanks area.
Whooping cough is a bacterial infection caused by Bordetella pertussis. The disease causes symptoms such as heavy and sudden coughing fits, fever, vomiting, fatigue, and difficulty breathing. The early symptoms such as fever and mild cough appear within the first 2 weeks of infection, with later symptoms running another 6 weeks or longer. Returning in cycles of 3 to 5 years, pertussis is once again on the rise.
We've had 154 cases, and that's just the cases that are diagnosed and reported to us. So there are a lot more cases that are undiagnosed and not reported to us.
71 of those cases were reported in July. That's also a record high for the last 8 years, with the next highest count being 149 cases in 2016.
In terms of Fairbanks, year to date, we've had 24 cases.
3 additional cases have also been reported for the Fairbanks area this week. The increase is cause for concern as the community's youngest members are at highest risk of severe illness and death.
Fortunately, pertussis is vaccine preventable.
There are 2 vaccines for pertussis, one for children called Tdap and one for adolescents and adults called DTaP.
Pregnant women should receive Tdap during each pregnancy, ideally during their 3rd trimester of pregnancy, and that helps protect their newborns.
For those that do get sick, the illness is treatable with antibiotics, but younger patients may be hospitalized if illness is severe.
If you're an infant and you get infected with pertussis, your chances of hospitalization are high, about 1/3.
About 1 out of 100 hospitalized infants with pertussis die from the disease. Close contact should receive treatment for exposure, especially if they work or live with young children. As for transmission, the disease spreads most easily in the first 3 weeks after infection. This is Adrian Peterson reporting for News Center Fairbanks.